Okay, so despite all the support that now exists for primary care, the Affordable Care Act, in organizations and employers now investing in primary care, paying more for primary care, it's still actually not the easiest environment to transform primary care, right? It's not the easiest environment to innovate, to advocate. Changemakers really face a daunting task in the United States right now. Do you guys sort of agree with that? Yeah. And despite some of our best efforts, sometimes we wonder, are we making a difference? I'm just wondering, how many of you wondered that in your leadership efforts, your innovation efforts, wondering, am I making a difference right now? Yeah. We all face that. So how do we deal with that? Resilience, community, and tools. Right? Tools. So we want to introduce you guys to something called the Changemakers Triangle, which is basically a comprehensive framework for affecting change on the issues that you care about. Now, you know how in our clinical lives we have a comprehensive approach to patients, right? So a patient comes in, they've got an issue, we can go right to meds, send them to somebody else, have a conversation, right? All these different approaches, all these different tools we can use. But what we're trying to do is provide a similar comprehensive set of activities that you can do to affect change on important issues. And so the Changemakers Triangle basically consists of three major types of activities: events, awareness-raising activities, and advocacy. And I'm going to talk about these in a sec, but the goal of the next 3 or so hours, or maybe it's 2.5, maybe it's 90 minutes, I don't know. The goal is to, first of all, get you comfortable with these different sorts of elements that can be part of your package. Number two, to help you develop mindfulness about your tendencies to gravitate towards certain of these types of activities. And finally, help you develop intentionality about which types of activities you're going to choose to advance your effort, whatever it is. Does that make sense? Okay, so events. What are events? They're events, right? It's like last night. Wasn't that fun? Wasn't that awesome? Events are great at bringing people together, okay? They're great at building momentum, supporters, developing community. So it could look like a happy hour. It could look like a rally. It could look like a speaker you bring a bunch of people to. Awareness-raising activities, slightly different. There, you're changing hearts and minds. You're changing the way people feel about an issue, right? You're swaying the decision maker. Or you're taking supporters who are psyched about the issue, but you're helping them really understand the issue. So it can be a workshop. It can be a training. It can be a website that you create, a pamphlet. Finally, advocacy activities. That's where you're changing policy. That's where you're affecting change that lasts. You change a policy. You change a procedure. You change a system. Your school doesn't pay for faculty to mentor students. You get them to change that. That's advocacy. Now, if you look at most examples of change making in our society that have been really successful, what you see is a combination of this stuff, right? So literally, since the dawn of time, change makers have been putting all this stuff together. So, Moses, for instance, right? Going in to talk with the Pharaoh, right? Let my people go, right? There was a advocacy in there. There was awareness raising. There were events. I know from experience. Now, here's the thing, though. In healthcare, if you watch a lot of health professionals trying to affect change, we tend to really focus on just one of these types of activities. We tend to really be narrow in terms of the tools we rely on. Would you agree with that? And what is the usual type of activity that we go after in healthcare to affect change? What do we do? Exactly. Education, awareness. I want to change how providers behave on this particular issue, how they prescribe, how they act clinically, what do? I get a bunch of data. I do a study. I get into a journal. I try and get into another journal. All right? I present on grand rounds. And then I say, why has nothing changed? Because the problem is, each of these approaches has some really significant benefits, but they also have weaknesses. And when you only rely on one of these types of activities, when you're trying to affect change on a big issue, the weaknesses pile up. And they can actually derail your efforts. So let's talk about this for a second. Let's talk about the pros and weaknesses of each of these things. So events. What are the pros of events? They're fun. They're fun to plan. They're fun to go to, right? We're having a party, and we're going to have chips and salsa and guacamole. Yeah! Right? What's the downside of events? Expensive. One time. Right? Do they affect change? Not really. And what happens if your supporters aren't actually informed about the issue? How long do they retain their support of your issue? Yeah, not a long time. Okay, so events have pros and cons. How about awareness-raising activities? Awareness, that could be pretty powerful in the long term, right? You change someone's mind on your issue, primary care revitalization, or teamwork, that person's going to be an ally for life. But what happens if all you do is educate people? What's the weakness there? Yeah, it's hard to get excited, and also, great, you got a supporter there, and you got a supporter over there, but unless you actually bring your support together, you don't have a community. You actually can't mobilize power. And if we don't translate changed minds and hearts into actual policy change, those changes just remain ideas. Okay, so awareness-raising activities, there's pros, but there are also cons. What about advocacy? What's the good thing about advocacy? You change laws, right? You change policies, you change systems. That's huge. What if all you do is advocate? No community. And why is community important? The law you change, right? Good to go forever, right? No. Sometimes it needs to be updated, right? Changing times. Sometimes it needs to be defended when other people want to get rid of it. If you don't have a group of supporters who understand it, you might lose it. So, as a change maker, what you're essentially doing is you're trying to put together these activities in a really intentional way. Do we have any budding mixologists out there, craft mixologists? Anyone? Come on, raise your hand. Okay, this is weird. I'm not. Some of my best friends are. Well, here's the thing. What you're doing is you're basically pouring a cocktail, right? In an intentional manner. Right? So you're like adding a little bit of this, and let's add a sprig of this, and excellent. Enjoy. Good night. You're doing the same thing as a change maker with these sorts of activities. You're putting together in a very intentional way a set of projects and things that are going to result in a particular outcome. And do you guys remember earlier when I told you that story about Harvard, right? The things we did at Harvard? That was actually a cocktail, right? So we had town halls, we had a letter writing campaign, a petition drive, we had events, right? We also created material. So there's a whole combination of things that we put together for the entire initiative to affect change. Now here's the thing though. What did Steph teach us this morning about being intentional? What's the first step to intentionality? What do we got to be?
Self-aware.
Self-aware. So I'm going to make the case to you guys that each of you has a tendency as a chapter leader. Your groups have a tendency as a team to gravitate towards one of these types of activities. It's not right, it's not wrong, it just is. Just is. So if we're going to start being intentional about the activities that we start pushing forward, it's worth us taking a minute to feel and think about where do we gravitate and what sense do we make of that tendency. So I want you to take 1 minute to turn to the person next to you and talk about your chapter, whether you've done these activities or you're planning on them. Where do you tend to gravitate towards and what sense do you make of that? Go. All right. Let's come back together. So, what did you come up with? Where does your chapter tend to gravitate? Remember, there's no right or wrong answer here. It's just a tendency. We're being self-aware. Where do you guys tend to gravitate? Events. Events? Yeah, go for it.
I guess events, but not in the sense of like one-time events, but I think more like projects, like a health class or something like that. Like,
Okay.
I don't know what that would like.
So health education class sounds like an event plus awareness raising, because it's education. It's actually Tony that pointed this out to us yesterday when he said, you keep calling it the Changemakers Triangle, but it's not a triangle, it's a Venn diagram. Because there's certain things that, like what you just described, are sort of like there, which is, I would actually say, what this conference is, right? Okay, so events, but awareness-raising events, but everyone else has said events. Is that true? Do you guys feel like it's mostly events? What sense do you make of that? Why is that?
Easiest to attract people.
Easiest to attract people. What else? They're fun. Yeah, and it's nice to have fun in health professions training school, right? Yeah. What else?
You have a lot of turnover in health
Yeah.
professional school, and so you can impact change immediately with that group you have right now
Yeah.
versus investing that time in a way that's a little bit harder with handoff.
Excellent. What else?
Immediate results, so you can see how many people showed up. You can't really look at awareness that way and say, we touched this many people.
Yeah, exactly. So there are all these reasons why we have these tendencies. Both they're in us, but they're also in the local environment. There's no right or wrong to this. Your chapter might decide we are going to do only events this year. What we're asking you to do is to just be intentional. Have choice. To say, we're doing only events this year for a very specific reason. And Peja, I don't know if you're here, Peja. Peja told me a story yesterday. He said, you know, we, in Serbia on the Move, did only events for a year, and there's a very particular reason we did that. Peja, why did you only do events for a year?
Well, we wanted to first of all, to gather as much people as we to build our foundational list of people who are interested in this, and also like to get them, to connect them to each other, to build a sense of solidarity and of identity. But it was intentional. We knew that at one point we will get into a place where we're going to start doing more advocacy or awareness. And the purpose of doing a bunch of those events just to do those two things, like get our list bigger, make our list bigger, and then also like connect people and create a sense of collective identity and solidarity.
Excellent. So our goal over the next few hours and weeks and months is that you're going to gain more comfort and understanding with the different reasons you can use these different types of activities and the impact you're going for. You can continue being mindful about your tendencies. And 3, you can be much more intentional about what activities you choose to do and why. What you're shooting for, the outcome you're trying to achieve.